The most important decision anybody will ever make in their life is whether or not they're going to go to treatment. We all know that if somebody doesn't get the help they need for addiction, they die from it. Yeah. It really is. Without sounding too melodramatic about it, people die from this stuff. And we're in the business of creating an atmosphere in which these miraculous transformations can occur. And that's our responsibility to do that. And part of that is connecting with these people on a meaningful level that helps them to begin to establish trust.
Hello, I am B. Reeves with New Waters Recovery in Raleigh, North Carolina. Welcome to our weekly podcast, Finding New Waters. Our goal in creating Finding New Waters is to provide a resource for families to help navigate the complexities of supporting a loved one struggling with substance use or mental health. When we find ourselves in crisis due to one of these issues, most people have no idea where to turn. We hope to shed some light onto what is often the darkest hour for many families. Thank you. Good morning, everybody. My name is B. Reeves. I'm the Director of Business Development at New Waters Recovery, and I'm joined by my colleague and CEO, Justin McClendon. And our guest today, we're very honored and happy to have Charles Odell, who is the CEO of the Dilworth Center in Charlotte, North Carolina. So welcome, Charles.
Thank you very much, B. I appreciate it. It's nice to be invited.
Yes, sir. Well, as we were getting ready here, we were talking a little bit before we started recording about how the acuity levels and you were just mentioning how treatment and addiction has sort of ramped up and is a little bit different between post-pandemic. Can you speak a little bit to that?
Sure, I'd be glad to. You know, I've worked in treatment for a good long time, a little over 35 years now. And of course, through the years, we've all seen, those of us who work in this business have all seen an evolution of sorts in the way in which addiction is addressed and some of the co-occurring disorders as well, process addictions, et cetera. And what we've seen lately over the past, say, 3 years since we've begun to emerge from the unique circumstances associated with the pandemic is new sets of challenges. And I really don't think that the pandemic was very kind to people who suffer from substance use disorders or other mental health disorders. And the isolationism, people have lost jobs. When they lose their jobs, they lose insurance. And so the barriers to recovery become more pronounced, and that creates challenges for organizations that provide substance use disorder treatment. What can we do to reduce those barriers and try to help these people the best we can? And, you know, I think basically what I'm seeing is very challenging times. It's different. And I think we're all feeling that, those of us who work in the trenches, you know, helping people day in and day out. We feel it and we see it.
Mm-hmm. It's true. And I think, you know, we see that as well at New Waters, right? Like you mentioned, Charles, the level of acuity seems to be something that, you know, more frequently, I think we're seeing individuals that are struggling with a higher level of acuity than we did, you know, 5-10 years ago. And then I think also just, you know, networking in the field and speaking to other professionals in the industry that, you know, we're not alone in that. It seems that there's a widespread, you know, kind of, you know, epidemic, if we dare call it that, to where it seems like there's just, you know, a lot of people that are struggling more these days. I think there's just a lot more pressures on people societally and in our culture that are probably producing a lot of that. And then, you know, addiction, right? I think historically we see addiction as something that people reach to as a way to find relief in life from some of those things. And unfortunately, I think these current times are no different.
Well, I would agree with you. One of my roles these days, I'm on the board of directors of the National Association of Addiction Treatment Providers, and that organization has been involved in developing an outcomes measurement program over the last 5 years. It's really kind of a game changer for our industry. We now have over 120, if I'm not mistaken, treatment centers throughout North America that have implemented this evidence-based valid measurement system for measuring outcomes of patients not only through their activities and treatment, but beyond. And one of the data points that I find interesting in that, we're a data site for that program, by the way, but one of the data points that we find nationwide is that 92% of those people admitted into substance use disorder treatment last year have a diagnosable secondary or mutually existing mental health condition, most common of which is trauma and or anxiety followed by depression. So these issues simply have to be addressed. And of course, we've seen, people with substance use disorders for years struggling with other disorders, but what we're beginning to see is an escalation in the acuity, as you said, with all of these issues. And that creates the necessity for treatment providers to address all that. We simply have to do a good job with that.
Yeah, it seems like the silver lining of COVID is so many people had these underlying issues bubbling, percolating under the surface, and they were brought up and exacerbated during COVID. And it's just a matter of if they can find and get and continue to receive the help. But it seems like people who are destined for crossing the invisible line into addiction or alcoholism found it a little bit faster than they may have otherwise.
Yeah, I think it accelerated it. And also the thing we hadn't even touched on is the overdose epidemic. I mean, we're seeing the same thing that everybody else is seeing. I think the numbers last year were over 100,000 Americans had death by overdose. 70 to 75% of those deaths are attributed to overdose on opioids. And of course, the most common drug of overdose within opioids is fentanyl. So that story's been playing out for a long time, certainly before before COVID hit, but it's been exacerbated as well. And the dangers are very clear and present. And it's also complicated by the fact, I don't know how it is where you all are, but in my neck of the woods, it's kind of hard to get in to see a psychiatrist. You
Absolutely.
You might try to make an appointment. It's 3 months out. And people with these types of challenges, they can't wait 3 months, So, I mean, one of the things we've had to adapt, our medical director is a board certified addiction psychiatrist. Chris Lord is his name. And our patients who come to see us can see Dr. Lord immediately upon admission. So that's one of the perks of, I guess, running a treatment center is we can get these folks the help they need. But the average person out on the street, they can't access that care as easily as they need to. And I think that's creating additional problems too.
Yeah, I think you're exactly right. And we see that as well, right? On the front end and on the back end of a client admitting at New Waters. I mean, if we have someone that's, fentanyl or opiates has been their substance of abuse, and they're on the fence on whether or not they need to come in for an inpatient detox stay. I think there's some validity to that argument, right? Depends on the severity and what's going on. We do have things like buprenorphine available. If the client is appropriate, they can see an outpatient psychiatrist and there can be some work that's done there. But to your point, for them to reach out to a psychiatrist and find somewhere where they can do that is almost impossible, especially when they're in a place where there's a window of desperation and an opportunity for them to take some steps to make some changes in their life. They don't have the luxury to wait for a month, 2 months, 3 months to get an appointment because it is extremely likely that there's, bad things that can happen during that time frame, right?
I'm in long-term recovery. I'm a person in long-term recovery, and I recall just my own story of when I kind of got to the point of desperation where I was willing to ask for help. The pain of recovery became less than the pain of continuing to drink and use. When I reached that turning point, there were people there who helped me immediately. And, it really does beg the question, if we cannot help people when they ask for help, we run the risk of becoming irrelevant. And
So true.
I think it's hard. I mean, it's difficult. One of the things we do here at Dilworth, people call us up. We want them to make an appointment, come in, sit down, talk, all that. And we can usually get them in within 24 to 48 hours max. We can get them in for an appointment very quickly. But we also have people, we refer to them as walk-ins. We'll just be sitting here doing a day's work and somebody walks in the building and I need help. One of the ways in which we address that is we stop what we're doing and we help them. We don't say, make an appointment, call us back, or any of that nonsense. What we have to do is meet them right then and right there. Now, we don't advertise that as a service because you have 10 walk-ins a day or whatever it is, and you can't operate a program. But that's the kind of thing that I think in the vernacular associated with the program of recovery, in which we're all familiar, we have to take a searching and fearless moral inventory of our services and how we are addressing the needs of these people in a new and challenging environment. And I don't think there are any easy fixes for that. It's not easier, it's more difficult, and it's more complicated.
Right. Yeah, it's funny you mentioned that about the walk-ins. As we were opening New Waters in October of 2022, we had procedures and policies in place where we're not going to take walk-ins. Day one, get a call, guys literally in the parking lot, and we stopped what we were doing and got him in and admit him. And he's actually ended up being one of our star clients who has been sober now for coming up on 2 years. In October to be 2 years, and an all-star client. But another thing is, I do, in my job, we all do wear lots of hats. And when I'm on an admissions call, somebody is asking for help and seemingly has the gift of desperation at the moment. And they say those magic words, I need help. And I say, okay, well, let's get you in here today. And they say, well, I'm thinking about next Saturday, and my answer is, I get it. I know you have a lot to do, but when I hear people ask for help and then wait to receive said help, things don't typically go very well. So like you said, to your point, Charles, that window of opportunity, we never know when we're going to get another one, if we do, and it's always going to close, pretty soon, if not almost immediately.
One of the things we've found based upon our outcome evaluations and quality improvement measures is that if someone reaches out for help and they or we make an appointment for more than 3 days out, we lose 50% of them. They never show up for the appointment. So the idea is to get them in within a 3-day window, and ideally within 24 hours or even the same day, if at all possible. So it's that's logistically challenging, I think, for a treatment program to offer that service. But again, our job is to be there and to remain relevant when someone reaches out for help, and you never know when that's going to be. It's by someone else's timetable, not ours.
Yeah. And we live by that principle as well. As B mentioned, I mean, we could share many examples of, there's a plan, there's a process for this. And then sometimes somebody calls and they need help and we just throw the process out the window and do what's right. And I think, to your point, Charles, I think, operating in this space, which is providing treatment for individuals struggling with substance use and mental health issues, you really just have to do that, right? I think that's just what helps us continue to provide service and value for those individuals in need. And I'm not going to get on a high horse here, but it is very frustrating to me when because we do basically anybody that comes to New Waters is going to be an outbound referral. We stabilize, we detox, and we work very hard to get them to that next level of care. So we talk to a lot of treatment centers at all different levels of care, and it is very frustrating when we say, hey, we have this 4-day window here. We need to get the admissions process done so that there is a seamless transition of care, and it becomes a hurdle or sets of hurdles in order to navigate that, to make that happen. It's just very frustrating to me.
Yeah, I understand. And, we're all advocates for these people. I mean, they come in, they're asking for help. We're in a position to provide that. And the situations are always complex. I mean, you're dealing with people. I just think back, going back again to my own experience, starting treatment is a very emotionally challenging time. And there's a lot going on. It's like that old cartoon, where you had the devil on one shoulder and the angel on the other, and the angel's going, "Oh yeah, you need treatment. Come on in." The devil's going, "Nah, man, one more day. You need, you can go in tomorrow. Go out and have a couple of drinks tonight." So there's this internal battle, I think, going on, which is really normal. I mean, everybody has reservations about committing to a treatment process, I'm sure, some more than others. And so when you're dealing with people who are emotionally challenged on that level, it really does take a challenging set of circumstances to be able to provide the care they need. Really good clinicians who can establish some level of rapport. Patience is certainly necessary. Empathy, understanding. I mean, the most important decision anybody will ever make in their life is whether or not they're going to go to treatment. I mean, we all know that if somebody doesn't get the help they need for addiction, they die from it. I mean, this really is. I mean, without sounding too melodramatic about it, I mean, people die from this stuff, and we're in the business of creating an atmosphere in which these miraculous transformations can occur. And that's our responsibility to do that. And part of that is connecting with these people on a meaningful level that helps them to begin to establish trust. That's a lot of responsibility. That's not a very easy thing to do. My background's in clinical work. I was a counselor long before I was an administrator, and I certainly understand, the clinical challenges associated with providing treatment. And, this business we're in, I mean, it's tough stuff. But it's also, of course, very rewarding. People do get well. And I think, I'm not sure who the audience is today. Sometimes I guess it may be professionals and sometimes others. But one thing I want everybody to know loud and clear, treatment works. And one of the data points that we've identified in our outcomes measurement system is that if you look at someone 2 years out, 79 to 80% of them are still reporting sobriety. And that's pretty much on par with what we're seeing on the national level in terms of the outcomes measurement program established by the National Association of Addiction Treatment Providers. 80%,
I hear you. I'm a product of it myself.
Yeah. So,
Charles, what have you seen? You've cited this research a lot, which I'm very, very interested in. What have you seen as far as variables? So you mentioned this 80% kind of success rate, and I don't mean to put you on the spot, so feel free to pass if you need to. But what are the main variables that you guys are seeing as far as what determines success there?
Well, that's really a good question and a fair question. I'm not at the point to be able to dive into the data and answer the question specifically, but I can say on a general level there are a couple of points that are extremely important. One has to do with connectivity. Addiction is a disease of isolation. And so what happens is people get disconnected from their families. People get disconnected from what could potentially be a support system for whatever it is they're going through. And of course, addiction tends to promote within the individual the tendency to keep secrets. Well, I'm full of secrets. I'm not telling everybody what's going on with me. I'm the only one who's ever experienced these feelings of desperation. And they don't want to talk about it because a lot of this stuff is shame-based. So what we're seeing in recovery is a connection to these support systems, connections to families and other peer groups that enable an individual to begin to process out loud with people what some of their challenges are. And of course, we know mutual help groups, Alcoholics Anonymous, Narcotics Anonymous, that's a very significant data point in terms of supporting long-term, robust recovery. So we see the connectivity following through with what most treatment centers would refer to as aftercare continuing care plans. Those are usually individualized for people. For example, if they have mental health care needs, they have to make arrangements to address those on a long-term basis. Now, that could mean ongoing counseling, perhaps psychiatric care, in addition to some of the fundamental recovery components of substance use disorder recovery, such as the mutual help care programs. So that those are some of the points that we're seeing that are clearly significant. And this may escape some folks. It's clearly obvious to people like you and I, but a component of success is abstinence. Okay. I mean, the research does not show that recovery is bolstered by moderation management. Okay, we're talking about abstinence from mood-altering substances. That's old school assumptions, but in some quadrants in our country, we certainly see situations in which people feel like they might be able to use moderately, and there's some support for that, but the evidence doesn't bear that out as being very effective in terms of promoting recovery.
I hear you, and I agree. And there's a place for everything, but without getting too personal note, all I'll say to that is, especially as far as MAT goes, for me personally, I'm glad that it wasn't presented to me as an option, because I would have taken it.
Well, I think medication for addiction is helpful in terms of immediately providing an entry point into the healthcare system. If somebody is out on the street, for example, using opiates, they're at risk of dying any minute. The overdose deaths are very clear. The risk factors are escalated, and they're very clear. If you can get somebody off the street today by giving them some medication, it buys enough time to develop a more comprehensive, ongoing treatment regimen. And so I'm not, my personal view about medication is that it's more of a harm reduction approach as opposed to a recovery approach. But I do understand that, if you can get somebody stabilized and off the street and not doing what they were doing before, it gives you an opportunity to move forward in a more productive way. And it's all about saving lives.
Yeah, it's all about saving lives. I completely agree with you, Charles. Matter of fact, as I'm listening to you talk, what comes up is, like Maslow's hierarchy of needs, right? Like nothing else matters if we can't survive. And I think, we agree completely that if it's medication, if it's medication assisted treatment, if it's some other type of harm reduction approach that can save their life, then we're all about that, right? And to your exact point, Charles, and then there's a process from there, like, do you want to actually experience relief from this disease and this misery that you're probably experiencing? And if so, there's some other steps that we can take to maybe move towards abstinence and actually experience some really serious change in your life, but those are two separate things for sure.
Well, it goes back to what I was told long time ago. Recovery is a process. It's not an event. It doesn't
That's
occur
right.
overnight. It occurs or evolves over time. And,
Mhm.
if somebody's been drinking and using for 20 years, they're not going to get well in 20 days. I mean,
Right.
what you can do is you can start the process in 20 days, but the recovery process is going to continue. And for those of us in long-term recovery, myself included, it's not alcoholism, right? It's alcoholism. I'll be in my support meeting tomorrow,
Yeah, that's great.
So it's, what's that old saying? The cost of freedom is eternal vigilance.
That's
You have
right.
to stay on it,
Yeah.
and that's okay. I know some listeners might be listening to that like going, "Oh my God, you mean I've got to do this forever?" Like it's some kind of drudgery or something, when it's
Right.
really
Yeah.
not. I mean, what recovery does is it maintains those personal and relevant and meaningful connections, and those connections are made through the process of recovery, which enables us to be teachable and to be around people who have already done what it is we're attempting to do, which is to continue our recovery journey. I think it's really important to remain teachable. And, it's like that old saying in recovery, when you're green, you're growing. When you're ripe, you're rotten. I mean you got to keep moving. And
You got to keep
besides,
moving.
if everybody got what they needed and went home, who would be there for everybody else? If you're
Yeah.
playing a game of marbles and you take your marbles and go home, the game's over. So
Game's
you
over.
have to be able to be there for other people. And of course, any kind of, I think, social structure, community understands the validity and value of people helping people.
Mhm.
If I'm in a position to provide help for somebody else, it in turn helps me. So it's
Mhm.
not all about what the program can do for me. It's about what I can do for the program, finding a sense of relevance in my newfound lifestyle that's beneficial not only to myself but other people. That's the kind of
Mhm.
stuff that I think a lot of people don't understand when they start recovery and what the potential of this thing really is.
Yeah.
That we're really talking about people becoming whole
Yeah.
individuals
Which
and
is
conducting meaningful lives.
Yeah. Which is true. I think we could say true for all people, right? Not just
Sure.
individuals that have struggled with, mental health or substance use disorders, but you think of just your average Joe or Jane for that matter, right? That, has never had to struggle with these types of things. But without those same ingredients, without community, without purpose, without, waking up every day and trying to put some effort and some intention into, trying to live a good life and find some
Mm.
peace in there somewhere, then they also, I think, suffer with misery and things like that, right? So it's, I think, and I could get really philosophical about this, but I'll spare everybody that. But I think, addiction and or the mental health component is, there's almost a piece of that where it's like at least it gives a focal point, right? There's at least like a thing, there's a path. And I feel sometimes really bad for individuals that maybe even don't have that, but are really struggling and they just don't know exactly what to do about that. Is that I'm going to pick up a self-help book, or maybe I'm going to go to a therapist and someone can start to provide me with a little bit of a path. But without having that focal point, it's almost like, we're struggling with the same stuff, but it's just showing up differently, I think, right?
Yeah, I heard somebody tell me one time a long time ago, they said, all successful people kind of practice the 12 steps, whether they realize it or not, and
Right.
that may be a point that someone could debate, but I think what we're talking about here are kind of universal truths on how to successfully live your life. And part of that has to do with taking care of yourself, but also being there for other people as well. And to keep a good eye on, how you're doing, because you can be okay for a while and then kind of get into some kind of quagmire of discomfort or new challenges that can create difficulty that maybe you didn't see coming. I mean, life is not a spectator sport, I mean,
Right.
it goes on. And one of the things I've noticed as I've gotten older is things come out of left field you just don't expect. Life is difficult. You may lose someone you didn't expect to lose through death. Something may happen at work. You could have some challenge that happens with your marriage or your children. These things happen all the time. And as the challenges present themselves, what are you going to do about it? How are you going to handle it? And I think people who kind of are normal, non-addicted, no real significant mental health challenges, they've learned how to operate in life. Not that it's not difficult for them, but as we all get to the point where we're operating better, whether it's somebody with a mental health issue, somebody with addiction, or just a regular person, once we're all kind of getting to the point of being able to handle life on life's terms more successfully, we all end up being pretty much the same. These barriers between each other start to dissolve. It's like I'm around a lot of people day to day in business that, they don't know anything about addiction, but they're successful people. And we have a lot in common because we're handling life pretty reasonably successfully, and we can do this together. So it's an interesting thing, this thing called recovery. It basically allows us to re-enter into society and become successful and productive. It really is remarkable.
What you're saying here makes me think of when I first got into recovery. When I heard somebody say, when I was a kid, everybody seemed to get a map to life, but mine was upside down, or I didn't know how to read it. And that, I feel like that's kind of what you're saying here, is because, I was presented with literally every concept from that, borrowing from religion and medicine and the golden rule. And I just didn't know how to apply it, or it didn't register. But once I got sober and found myself in recovery, then I was able to have that Rosetta Stone to that map and figured out how to live like a reasonably happy life and normal life, and was able to be a productive member of society, contributing instead of just kind of being a spectator and more in taking. And, all this also reminds me of when I first got into recovery, when I started hearing people say, I'm a grateful alcoholic. At first I was like, what do you mean?
Yeah,
But I think that a lot of that gratitude comes from being grateful that we finally figured out how to live, and the feeling of being sentenced to a life of meetings and taking care of ourselves, or it can seem like a punishment, but it's really not. And it's one of those, I get asked these questions, you still going to those meetings? It's like, oh yeah. I mean, it's so nice to be able to get to go and want to go rather than feel like I have to go because my ass is on fire.
Right.
And the one of the many paradoxes is, the more I do for my recovery, the more time I have for everything else, more independent I am as a result. And we can only keep what we have by giving it away. And like you just said, it's just, it took me a long time to figure out how to live. And it took me, to a pretty dark place to come out of it to be able to live a reasonably happy life. So
Yeah, I hear what you're saying. I remember when I went back to school after years of being away, as a non-traditional student, which is a polite way of saying you're old. But I went through
Yep.
I went through undergraduate and then went on and got a master's in social work. But I remember when I was finishing up undergraduate, I did a minor in religious studies, and it was real interesting to me. I think all the minor meant was you had to take 6 classes with under that particular department. And so we studied all the world's religions, and one of the observations that I walked away with from that is that, in reference to the 12 steps, for example, there's nothing new in there. Those philosophies are similar in most all the world's religions, but what's different about the steps is that they're numbered. It's like,
Right.
okay, start with number 1. Can I go to number 3? No. You have to go to number 2. Now let's assess where you are. And then that's what's unique about the steps. That's the brilliance behind it. That's the genius. And what it does is it makes the recovery process uncomplicated. It's not easy. People will say it's the hardest thing they've ever done, but it's not complex. You start with number 1, then you go to number 2. And I think what that does, alluding back to what you were just talking about, B, is it provides a clear instruction, or now I have a roadmap and I know what to do, and I'm working with other people who are helping me to accomplish this. And I think that's one of the things that, people who are not subjected to the idea of applying the 12 steps to their lives, they don't need it. Perhaps they're, regular, normal people. They're not alcoholics, they're not addicts, they're just people. They don't always have the clear roadmap. They may go to their place of worship or professional counselor or peer groups or organizations of individuals that kind of come together to provide assistance to other people, whatever their mechanisms of connection are. The recovery map is not always as clear as I think it can be for those of us who were experienced to the roadmap of recovery when we got into treatment. And I think that's a good thing. It's one of the reasons why it's really grown, I think. I mean, I remember when I got into recovery in 1982, there were 82 12-step recovery meetings in Charlotte. That's where I am. And that's a lot of meetings. 82 in 1982, that's how I remember it. Today, we have over 1,000 a week.
That's amazing.
So those things only grow for one reason, and that's demand. And so what we're seeing is people talk about, the opioid epidemic, the addiction epidemic, and all that's true. But what people don't always talk about is the recovery epidemic, that people are getting into recovery in increasingly higher numbers as the time goes by. And that's the good news. That's the good news. Treatment works, recovery is real.
I love that. Love that.
How did you get sober?
Well, that's a good question. Sometimes I look back at that and I'm not even really sure. In my case, I drank and drugged for 14 years. I started when I was 12, just a kid, sneaking beers out of my parents' refrigerator. And of course, that was in the 60s. And so people were smoking pot and stuff. So I started doing that, and, things progressed, and I got into a lot of trouble. I mean, I flunked out of 5 universities and colleges. I got 2 DWIs and a reckless driving. I contracted hepatitis C from, kind of a blood-to-blood transmission thing. And, I couldn't hold a job, and things got really bad for me really fast. I mean, by the time I was 25, it was not good. I mean, and of course, everybody could see it very clearly except for me. And I think for me, and I said it a little while ago, the pain of recovery became less than the pain of continuing to drink and use. And I think also my family began to realize that. My mother started going to Al-Anon. We hate it when they do that, by the way. I remember one time I landed in I landed in jail for a DWI, and I called my mother to come get me out of jail, and I heard her say on the other end of the phone, "Son, you got yourself into this mess. You're gonna have to get yourself out." And she hung up, and I was going, "Oh, where did that come from?" I mean, I think that's kind of like I remember Father Martin. I met and talked with him a number of times back in the day, and of course, he produced all those videos that everybody watched when they went through treatment in the '80s and '90s, and founded Father Martin's Ashley, which is a wonderful treatment program. He used to say that pain is God's gift to the alcoholic. And it's through pain that we decide that we're going to get well. And to use a Christian analogy, there has to be a Good Friday before an Easter. And you have to allow that to occur. And that's what my mother was doing. She said, "I'm not going to be part of your addiction. I'll be part of your recovery. I'm not going to bail you out, but if you want to go to treatment, I'm there for you." And I stood at the turning point for about 6 to 9 months with that as things got worse and worse. And finally, I just said, "Uncle, I give up going into treatment." And I did. And so the recovery began at that point, and that was 1982. So this year, knock on wood, I'll have 42 years sobriety.
That's amazing.
That's amazing.
That's
the father.
They say in AA, how do you get to be an old timer? You don't drink and you don't die. Right. So I'm working on the not dying part.
There you go. There you go. That is amazing. Well, congratulations.
Yeah,
Charles.
congratulations. Tell us just exactly, we know what Dilworth does, but please tell our listeners exactly what y'all do, how to find you, and all that. Sure.
Well, we were founded back in 1990. I've worked in the field of addictions treatment since the mid 80s. And a friend of mine, Jack Harville, founded Dilworth Center. And I was, had gone back to school back in the early 90s, and I was looking to moonlight, and so I came over to Dilworth. Jack hired me to kind of do some counseling while I commuted back and forth to school, and so I got connected with Dilworth. At that time, Dilworth was a treatment program for adults, an intensive outpatient program for adults. And it was good. I always liked Jack, and I always liked his approach to providing care. And I thought Dilworth Center did a good job. And so it was a no-brainer for me to be a part of that. Well, Jack retired. Long story short, I took over the CEO position. And since then, we've seen an evolution in our provision of services. We offer treatment for adults. We offer treatment for young adults, kind of the failure to launch group. We also have one of the area's only adolescent programs. We have family programs, of course, for each of those treatment programs for our patients. And I might add that family treatment is always free. We do not charge for it. I think it's one of the best things we do. We require family participation for our adolescent families. It's voluntary for everybody else, but nearly everybody participates. It's like 80% of our patient population, and the adult population has family involvement. We also do specialty services for what we used to refer to as impaired professionals. Specifically, we have groups for pilots. We work with the FAA, have for years, by the way, for over 20 years. They require their pilots to be in treatment for 5 years, ongoing care. I was talking to somebody the other day, and I said, well, we've got 5 pilots in treatment. They said, that's terrible. I said, those aren't the 5 you got to worry about. They're doing pretty good, monitored very closely, and their success rate dealing with pilots approaches 95% of their pilots who get into the recovery program find long-term recovery. We also work with the Board of Nursing of North Carolina to provide extended care services for nurses. And we also do a strong relapse prevention program, continuing care program, extended care program for some people. So it's pretty darn comprehensive. We've partnered with sober living facilities in the Charlotte area so that people can live in the sober living facility while they're coming to treatment, so we can mimic an inpatient stay. We got a number of our patients who are currently doing that. I think go out on a limb and say maybe 15% of our patient population may be doing that right now. So there's a lot going on over here, and we also do a lot of fundraising. We're a nonprofit organization, so some of what I do is fundraising, and we have an annual event every year that supports our scholarship fund. So last year we gave away a little over $600,000 worth of treatment. This year we hope to do the same.
That's great.
And basically that's just for people who cannot otherwise afford the cost of care. So we learned through our research a long time ago that money is always the primary barrier to care, or a primary barrier. And so if anything we can do to reduce that will enhance the likelihood that someone can enter treatment. So we like to think that if money is the only obstacle to treatment, it doesn't have to be. But reality is that's not always the case. But we try our best to eliminate that.
It's amazing.
Well, thank you, Charles. Thank you so much for your time today. And we love Dilworth. We love working with you, and continue to do the great work you're doing.
Well, thank you. And we respect you guys a lot, too. I appreciate being invited on today, and look forward to continuing to work with you.
Yes, sir. Thank you.
Thank you, Charles.